So about 10 years ago, we sat down. So I was raised by two physicians. Dad's primary care, mom's internal, north of Indianapolis. Yesterday and today, getting into town here, everybody picked me for an outsider apparently, and they said, "Where are you from?" And I said, "I'm not from California, don't worry." And they all seemed to like me. So apparently Indiana is safe. So they're like, "Oh, okay, all right, you're a Midwesterner, you're good." So raised by two physician parents, I figuratively and literally grew up in a doctor's office. The school bus would drop me off at my dad's office in Westfield, Indiana. My experience as a kid looking at what a town doctor is, I thought that's what all doctors did. How naive of me. So I go to college and I'm like, hell yeah, I'm going to medical school. I'm going to take over the family business. I graduated in 2009. And for all you history scholars out there, 2009 was a pretty big year for healthcare reform. No doctor I met said, "Chris, continue on. Medical school is a good idea." Not a single one. That's the first time anybody's ever laughed at that comment, so I'm okay with that. And even more kind of, they said, knowing, or actually unknowing what's going on with the ACA and where my career is going and where my calling really is going, not a single one of them, including my parents, would say I would go back and do medical school. That's 2009. I'm 22 years old. I remember the day that I shut my MCAT study book. I was doing an externship for Johnson & Johnson. I'm with finance and pre-med. I was all over the place. I still don't know what I want to do when I grow up, so it's kind of a blessing and a curse. I did a bunch of different stuff and still just kind of felt this tug into healthcare. And it wasn't until this idea kind of hit me, like a wet newspaper on a windy day. Something just kind of wrapped around. You just can't ignore it, right? And it was this concept of watching my parents get older and struggle. I can't tell you how many times that my dad, again, being a male physician, and I'm picking on us guys out there because I see this now in industry, the guys out there will just pick themselves up by the boots and just continue on. The only way out is through it type of mentality. He'd come home, pat himself on the back. He's exhausted. I saw 35 patients today. Great. And I'm like, that sounds terrible. Why are we celebrating this thing? And we go, and they had an independent group. It was called American Health Network. It was the largest independent physician group, I think, in the country at the time. In Indiana, Ohio, maybe a little Kentucky, Michigan, somewhere along in there. And they were going in negotiations to be bought out by, anybody want to guess who was buying that big physician group? Optum Healthcare, bingo. And they're like, well, we're kind of in our 60s. I don't want to do that anymore. This doesn't sound good. Like I mentioned earlier, their concept of selling their practice was giving away their patient revenue. No business owner in the world would say, this is a good investment. They're not giving me a multiple on my revenue. They're not giving me a multiple on my EBITDA. They're not doing anything. They're giving me nothing for my experience for signing me up for an employee. And so they said, Chris, I think we're going to retire. And I said, why? Well, reimbursements are going down, expenses going up. It's not worth it anymore. I have to have 3 full-time people just to scan documents into my system. They're still using that dreaded 3-letter word called the FAX machine. We said, well, why not just hang a shingle? So my dad is an FAA examiner as well. And so he had opened up the business to just run through pilots. I said, why don't you just do that? And he goes, well, that sounds great, but I think it's illegal not to take insurance. Light bulb. In my upbringing, we had dinner conversations that were completely different, coming to find out once I met my wife and her family. We had completely different dinner conversations. And I'm like, her name's Jordan. I'm like, Jordan, you guys don't talk about chainsaw wounds at dinner? This is weird. You don't talk about business and all that kind of stuff. She's like, no, we ask each other how our day was. I was like, that's so weird. So we said, why don't you just hang a shingle? And he said, well, I think it's illegal. And we said, well, we're going to look into that. And so we kind of did a barnstorming tour for about 18 months across the United States. We talked to doctors in Appalachia who were charging $15 because that's what cost of living was. We talked to people in California who would charge a $40,000 a year retainer. We said, there's something going on here. Direct care didn't exist. Concierge kind of did, but that was just for rich people. And so what we did is kind of pick all these different things together, and we said we have a lot of experience in like the first step. It's hard to start a business. It's even harder to grow a business. So we said maybe we should help doctors start doing that, and that's what we did. So about 2016. We started and helped my parents actually transition their practice. It was a 3-physician practice, and single-handedly in December 2016, we launched one of the largest DPCs underneath one roof that ever existed, and that was our first time doing it. And so from there, we just started getting better. We started getting better and better, building out this program. And so fast forward, Freedom HealthWorks right now has started about 160, 170 practices across the country in about 45 different states. Mostly primary care. We are working with specialists, and that's been a lot of fun too because we get to be creative with it. So that is a very long story about why I'm up here. We started the podcast, like I said, just to tell stories. Too many voices were not being heard. People had no hope. All right. If any Star Wars fans out there, rebellions are built on hope. However, hope is not a strategy. And I drill that into my team every single day. We're like, well, we'll just hope for it. No, you cannot hope for outcomes. It is a strategic and a tactical plan that you have to follow if you have any choice, any chance of success out there in today's world. I wouldn't start a hot dog cart in downtown Indianapolis without making sure that all my T's were dotted, my I's were dotted, and my 3-hour time difference. T's are crossed, I's are dotted, and we don't want this burgeoning movement to be impeded because people are afraid to ask for help. And so that's why, again, we set up this platform. Where is the remote? There it is. And so doing, again, not to be repetitive, so we started this podcast. And then about 6 years ago, I get a call from this group called the Free Market Medical Association. And they're like, Chris, we really like what you're saying on your podcast. Lo and behold, I actually had listeners, which was cool. We want to sponsor your podcast. And then about 5 years ago, I think 4 or 5 years ago, they said, Chris, we want you to come down and be the master ceremony for the FMMA annual conference. I think I got that call like 2 days before the conference started. I had no idea what I was doing. So going back and looking at me like earlier, I was like, oh God, why did I think that was okay to say on stage? So our podcast, yep, there we go. So what I did for this talk, I was like, there's a lot of stories to be told there, and how do we actually put this into action? That's a big thing. Like, it's great to talk about all this kind of stuff, but how do we actually do it? We talk about why we want to do things. I think everybody here understands why we're doing this, but how do you do it? And how do you do it in a way that works for you? So what I did was look at all of our podcasts, and I took the top listened episodes. I put them all together, and I said, what are the themes that all 3 of these top 10 episodes have? And this is what I found. So number 1, and these are kind of your takeaways, right? The system is absolutely rigged. It's absolutely rigged. Healthcare is not necessarily broken. The way we pay for it is. And with that, it is absolutely rigged. But here's the key. It's optional. People in this room, that system is absolutely optional with what you know and what you're able to do. Second one, the relationship is the product. I think you've heard that time and time again. How does a direct care doctor define quality? Was anybody listening on the panel? How do they define it? Time. Third one, the fix is simpler than we think. Is DPC the end all? No, it's not. There's a lot of other things that have to happen. We have to work with partners in business. For you stethoscopes out there, what I just said, you got to go work with the suits. That might make your skin crawl. It's the truth. But you got to work with the right suits. You got to work with suits that support you, don't beat you down. So when I find you at the boat later, and I said, what did you take away? These are the takeaways, okay? There will be a quiz. No. So theme 1, it is rigged. Yes, it is absolutely rigged. These are fun, and I got some different, kind of fun quotes up here. So when we talk about rigging, surprise billing, we don't know what that means. When we talk about hospitals charging $200 for a Tylenol, those are real costs. There are losers in that system. Prior authorizations that delay care, PBMs, profiting off of hidden rebates. I've probably interviewed 15, give or take, PBM company owners, all that kind of stuff. I still don't know what a PBM actually does. The best definition I ever heard was, it is an insurance policy for pharmacy. And I'm like, I don't actually know what any of those words mean either. So all kinds of confused. So it's the complexity, it is the opaqueness, it is turn the lights on and watch the cockroach scatter. And then codes. Coding chaos. We for a while there, my social media team was running a theme, and there was kind of like CPT code of the day. I think I actually had them shut it down when we found a CPT code that represented somebody getting struck in the head by a flying duck. There was somebody like pecked on a finger by a turkey or something, and you had to identify which finger it was. It was like, this doesn't make any sense. How are doctors actually supposed to do their job in any of this kind of stuff? So these are just examples of how the system is absolutely rigged. But again, it's optional. Everybody here knows the escape route. DPC, or if you call it concierge because there's a price limit, I don't really care. That's one thing that our industry does need to get better, is that we have to kind of coalesce and learn the vocabulary. That's a different subject. We use cash pay surgery centers. Now, what I just did right there, DPC and cash pay surgery centers, if you think of healthcare on a scale, or really a linear path, A to Z, A is primary care, Z is your surgery center, that's great. We've got bookends. For all you scholars out there, you got to kind of fill in the pages, right? So that's where we need the surgery care. We need the transparent pharmacy. We need health plans. We need insurance alternatives out there that are outside of regulations. That's why I love cost-sharing ministries, cost-sharing plans, whatever they look like. If all of us get out of here and say, hey, let's all put in $200 into account at the every single month, and we draw for that, great. We just create our own health share. That's the kind of simplicity that we absolutely need to continue this momentum. So again, theme one, we already have the exits. I am a student of history. I like to read a lot of nonfiction. Sometimes that's good, sometimes it's bad. I am like in the middle of Roman Empire history, and they weren't really nice people, which is crazy. They did some crazy stuff. But anyways, so if anybody is sitting there saying, like, how do we actually get into this mess? Jay, you talked about it a little bit there. So everything that we are seeing right now is a direct result from World War II. So in World War II, majority of men go overseas to fight. Industry is cranking out. There's a salary freeze. There's a wage freeze. So employers are saying, hey, come work at my plant and build airplanes versus going to build tanks. And the way I'm going to incentivize that is to give you employer benefits. That's where it came from. In the 60s, now we see the involvement of more and more government. Yay, everybody celebrates modern day. CMS is a thing. CMS takes over absolute complete control over healthcare, and now they're managing everything from residency spots to you name it, right? Managed care, and then obviously today with different kind of billing outcomes. Insurance wasn't created to deliver care. It was created to process risk. And somewhere along the way, it completely hijacked medicine. Theme number 2. So, again, a lot of these things are up on the board are kind of no-brainers. This is what I mentioned. We had an attorney on, and he handles a lot of billing issues for patients in hospitals, talking about the Tylenol, talking about cases where hospitals billed Medicare for something that never happened. How many headlines do you see right now where hospitals are getting fined and they're just stroking a check for $400 million because they upcoded and they shouldn't have? It happens a lot, but there's no consequences other than it's all kind of phony money. Patients can't get answers on bills. I know when we had our first kid, the insurance company and the hospital sent us, ping-ponged us back and forth so many different times on billings, we couldn't get an actual answer. These are real-world experiences. And I think I'm somebody who's relatively literate when it comes to handling healthcare issues. If you're just the general population and you get that bill, most people are terrified of bills from hospitals, and they cut the check right away. Never pay the first bill. Great Marshall Allen. I think that's a Marshall Allen quote. Yeah, people don't know that you can fight this. That if you flip your bill over, in very faint writing is their financial aid policy. Nobody ever looks at it. And that financial aid policy is very generous for vast majority of Americans, yet somehow medical debt is the #1 driver of bankruptcy. And I think it was a year ago, 2 years ago, the fastest growing, or the majority of people in medical debt actually had insurance. We just hit that about 2 years ago, I think, the last time we were there. So with the relationship being the product, this is, it sounds simple, right? You put a service industry and you get to talk to that person and then you get better outcomes because of it. So when doctors actually spend time with people, they don't have to worry about what's ever on the computer screen. This is what, and I was actually surprised by this. I figured, oh, like some of the biggest episodes are going to be about policy. You know, what kind of future laws can we pass, or something about catching the bad guys, something about fraud, anything along those lines. It wasn't. It was people listening to stories about how doctors are changing lives within their community. We hear things like, I feel like my doctor actually knows me. Thousands of people listening to these types of episodes just say, for the first time, I actually had my questions answered. I wasn't sitting here running down my list of things and saying, oh, hey, wait a minute, I didn't get my $10 copay out of you. People had nice time to actually be humans rather than just being seen as revenue maximizing codes that you have to put in the computer. I had a client of mine, Dr. Hugh, and she's out of Missouri. She goes, Chris, nobody teaches us how to run a practice. But once a physician learns that they can opt out and there's a way to do it and they can be successful, not a single physician I've ever worked with says, I'm going to go ahead and go back into the system. Not a single one. I've had people who are saying, like, I'm really interested in becoming a motorcycle mechanic if this doesn't work out. Not a single one of them said, hey, I'm going to go back and work for Optum. I'm going to go back and work for the hospital. Not a single one. They get that little spark of independence, and they're like, you know what? I am one of the most intelligent people in my community, and I am also one of the most empathetic and hardworking. Why are we constraining those people of our society? Because not everybody can be a physician. I did pre-med. I did not want to become a physician because I have a serious problem with authority, and I didn't want to operate within the confines of what the entire career and calling was going to. So with this one, like the big thing comes down to 5 letters. It's not a 4-letter word; it's a 5-letter word. Starts with a T, ends in a rust. Trust. That's it. When human beings trust each other, a lot of magic comes out of that. Now, it might be, kind of a, I think I can say this, it's 2025, I can say this, but every single one of us is different, and that's okay. It's all right. We don't all have to be the same. Our genetic code is completely different. And when we try to practice medicine based on codes and based on checklists, real problems and real people suffer. We'll get the vast majority of it, great. But within population health, and this is kind of me on a soapbox, in population health, well, the reason I have a problem with it is because if you're looking at something and saying 96% of these are going to go that way, you're talking about 4% of human beings, of lives. It doesn't need to be that way. What we need to do is unleash, again, the most educated, the brightest, the most intelligent, the most empathetic members of our community who actually care about us, which is, again, kind of rare this day and age. But we need to free them up to be able to go out and do that type of work. When it comes to group lives, again, it's all about trust. How do we implement plans? How do we implement solutions where I get to actually take care of my team? Now, there's a lot of times where employers might not necessarily cut costs right away, but their people are going to absolutely love it. But there are a lot of cost savings too, so don't get me wrong when I do say that. There's some fun little quotes on here that I just popped up. I think the one that I really want to call out is the physician quote. I fell back in love with medicine. Again, medicine's not a career, it's a calling for so many of the people out there. And what we're doing them as a society is marginalizing them, treating them as commodities. The third theme, it is actually simple. We don't need to go pass new laws. We don't need new AI. We don't need more bureaucracy, and we don't need additional middlemen. This is what actually works. It is all free market principles. It is free flow of labor. It is free flow of services. It's paying with healthcare with good old-fashioned dollars and cents. When I'm in meetings with policy advisors, that kind of stuff, and I say, well, we implement solutions that people pay with U.S. dollars. Most of them will kind of chuckle because it seems like such a foreign concept that I don't really care what's in your wallet as far as what your card says or what little logo is on top of it. What I care is, are you able to access the doctor that you want? And did you both agree upon a fair price? There is no one-size-fits-all solution. And I think that's something that our elected leaders really need to know. I interviewed an Indiana state representative named Julie McGuire, and she's super bright and one of the good ones out there. And something she said really stuck with me. She said, Chris, when it comes to fixing healthcare, we need accountability. We don't need complexity. I think about that. What is accountability? I talked about hospitals getting fined for fraudulent pay. In Indianapolis news, a couple years ago, there was a massive some case where a local hospital is actually paying referrals and influencing bonuses from their physicians because they weren't sending enough referrals to their own hospital. If you start talking about the massive conflict of interest of employed physicians within a hospital system, you start to perk up. If you're talking to employers and benefits plans and saying this is why you shouldn't work with employed physicians, because like it or not, if they don't refer your primary care case to a local specialist that's in that same hospital, they're going to get a very nasty letter from the administration saying, how dare you send somebody outside? So here's some fun data. I get to pick on great members of the FMMA. Joe Wilson, Frontier Healthcare. So they're down on the border in Texas. They're doing amazing things. So they're mostly focused on employer clinics. These numbers are coming straight from them. So one of the big fallacies within the DPC world and employer world was that when you implement DPC, you're going to see savings over years. The real sexy savings are pharmacy and surgery. That's what every single employer conversation I've ever been a part of, that's what they really go into when companies are trying, I need to cut my healthcare expenses. How do I do that? Well, great. We'll get you first year. We'll get you less surgeries. We're going to get you less ER, and we're going to cut your pharmacy spend. That's true. But what these guys found out is that when they implement primary care, they'll see a 30 to 40% savings within the first 6 months. Some of that is avoidance, but a lot of that is looking at CPT codes and saying, wow, for this membership, we're doing all these different things. Again, we're unleashing our physicians in this country to actually practice medicine. No more are generalists in primary care going to kind of be discarded as, oh, you guys are the people who couldn't become surgeons, so you're just kind of go over here. We're opening that up and really impacting and seeing the impact that a generalist can have on a very wide, diverse population of people. And that is so important. And so that's what Joe and his team found down there. Dr. Gold is a legend. He's out in Boston. Massachusetts has, I think they still call it Romney Care out there, but very intrusive government policies, still very much a burgeoning free market movement out there. So again, with the same theme of we need to free these doctors, not layer more restrictions and red tape on top of them. So I like to go over the takeaways just to really drill that home if you didn't recognize that right now. So yes, the system is absolutely rigged. These are what the top voices are saying. These are what the market is saying. These are what our listeners are finding, is that it is rigged, but it's optional. You have an escape plan. The top voices told us that the healthcare product isn't technology. It's not going to be some whiz-bang thing that minimizes the physician. It's going to be human element that actually maximizes that interaction you have with your trusted healthcare provider. There's a whole longevity movement going on right now, if anybody understands that. So, which is great. Like, I think people are finally realizing that, hey, I need to take care of myself. And how do I do that? I need a team. I need somebody that I actually trust. The third one, simplicity beats complexity. I think you've heard a lot of stories today talking about, hey, here's how we did it. And what we did was we took everything we were going over there and we said, what if the way we were doing things before wasn't really the best way to do that? Let's reinvent something. And you can absolutely do that, but you got to follow your first principle here of you need to opt out. That's why I'm a big fan of DPC. That's why I'm a big fan of this industry, is that it delivers all three. You hear some people talk about triple aim healthcare, the quadruple aim. I don't even know how many aims we have right now, but it's starting to get a little bit complex on that one. So what we need to do is free up consumers, free up physicians, to kind of meet in the middle, pay with good old-fashioned dollars and cents, but everybody has to opt out. And I think that's the biggest thing that is really holding a lot of this back. People don't know how to opt out. And that's what I love about the FMMA. That's why I've been a part of it for, years and years and years. It really is one of the only organizations that are actually living those values. So really in closing here, there's a couple quotes, couple questions. There's a revolution happening. It's happening. Whether you want to be a part of it or not is completely up to you. But it is going on today. We definitely need more people to be a part of it. It kind of comes down to, are you going to be a spectator or a leader? For the doctors out there, are you going to be able to run your own practice, or are you going to be bought out by Optum? You got two options right now. I hate to say it. You really do. For employers, are you going to be able to stomach another 12, 15, 20% increase? Or are you going to go actually do something about it? Because guess what? Those premiums are never coming down. You have options. You need to walk through the door. The fix is not going to come through Washington. It's not. Fix is rarely going to come through state governments, although it's a little bit better. Traditional insurance is great for paying for bad outcomes. What this room can do is prevent those bad outcomes. And that's what really we're about. That's why I'm here talking. That's what the FMMA is about here talking. It's the people in this room. That's where the fix is going to come from. Doctors, employers, patients who are fed up, who've had enough. Direct care, it's not the future. It's now. It's real. It's happening. I don't want to say you have to choose a side right now, but it's either time to get off the bench or we're going to keep on going without you. We don't want to. We need you. So the more people, the merrier. And that's why great organizations like the FMMA exist. We need good people. We really do. But again, it happens with you. It's not necessarily me. It's not necessarily anybody else. It's the people on the ground floor. It's the doctors, it's the patients that are making this thing happen. So that's kind of my call to action for you. Figure out a way to get involved. If you need to wait because time's not ready, time's not right to start a business, that's fine. That's perfectly okay. We've seen a lot of practices, a lot of great doctors who have failed in business because there's a lot of ways to fail in any business. But you need to plan ahead. You need to look ahead. You need to have a plan. If you don't have a plan, you need to ask for help. And that can come from other doctors. That can come from organizations like ours. People are very interested in helping you out, but you have to take some type of action. And that's where there's good people sitting there waiting to pick up the phone. So all you got to do is call them.